The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guests or hosts are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. We are all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. In each episode, we will feature very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to live their best lives naturally. Many women experience unpleasant symptoms before, during, or after their menstrual period. You may even be one of them. Introducing AOR's Femcom. Containing a combination of well-researched ingredients, Femcom is formulated to effectively provide healthy menstrual support, offer an emotional and mental calming effect, and helps balance hormones that regulate the menstrual cycle. Femcom is your go-to premium supplement to support and regulate the symptoms of the menstrual cycle. Get yours today at your local retailer or online at aor.ca or aor.us. Hello, and thank you for tuning in to another episode of Supplementing Health. I'm your host, Cassie Price, and today we are joined by Dr. Sarah Zadek, a naturopathic doctor located in Ontario with a clinical focus on women's health, endocrinology, and fertility. Welcome, Sarah.
Thank you.
So before we dive into our topic of fertility for both men and women, would you mind sharing a bit about yourself and how you got started in this field?
Absolutely. So when I started practice, women's health was always something that was very near and dear to me, just because I've grown up with quite a few different gynecological issues. I have endometriosis. So getting more than just an MD's outlook on what my treatment options was really important to me because I knew there was more than just having to take a birth control pill or there's more than just surgery. This is a longer journey than that. So that's what kind of got me into it as far as jumping into women's health and the fact that a lot of women don't know a lot about their cycles. I found a lot of my peers didn't even know quite how to count their cycles, like how long their cycles were. So even like the smallest things I found were being not discussed really in the realm of women's healthcare. So I started working with a group called Conceive Health here in Ontario. We're a growing group. We're actually situated within multiple different fertility clinics across Ontario. So I'm at the Whitby location, and what we do is it's basically mostly preconception healthcare. So that means we're looking at your healthcare before you want to conceive for the best and healthiest pregnancy, but also just so that you can actually get pregnant to begin with. So we look at a lot of cases of infertility and trying to find the cause of that. And we're finding more and more now, which is really exciting, that what used to be labeled as unexplained infertility, we're finding more reasons why women are infertile. So there's so much research going into explaining unexplained fertility, and that's really neat. And I hope we get a chance to touch on some of those topics in these podcasts.
Yeah, that's super interesting. I love the scientific fields for that reason, just how much things can advance, and one thing that seems set in stone at one point can change, the next day or the next week or a few years later kind of thing.
Yeah.
So can you explain what infertility is and share some of the more common causes?
Sure. So infertility, it'll have different definitions depending on who you see and which doctor or which medical care you seek. In general, we're looking at, if you've been trying to conceive naturally for 12 months and have not been successful, we consider that to be infertility. And it's especially so, I mean, we call it unexplained infertility when we don't quite know the reason why it's happening yet. That's why we have to go into further investigations. So the idea of infertility are just, people, men or women who are just having difficult conceiving, and also ones who are having recurrent miscarriages. Any type of pregnancy loss or recurrent loss can also be kind of considered into that realm because there are often either implantation issues or immune system issues. So infertility can really encompass quite a lot.
Okay, so I know you mentioned 12 months, but does that timeline vary depending on the age of the patient?
Yes, absolutely. So for women who are over the age of 35, we know that there is a bit of a clock running, and we want to address things sooner. So for women over 35, we want them to seek help if it's only been even 6 months of trying and not having a successful pregnancy. So at that point, we say, get into an OBGYN or a fertility clinic and start investigations as soon as you can.
Okay, and one of the things that we see sometimes in like comedy movies or, um, some of these spoofs is that, after conception or after intercourse, they'll get the woman to stand on her head or, they'll talk about certain positions mattering. Is any of that grounded in reality?
Um, it's hard to say for sure. I mean, it's not going to do any harm if you want to invert yourself. The idea is you want to have sperm in the area for as long as possible and give them a good chance. If you're going to stand up and shake around right after, you're probably going to have some sperm not staying in that area. So the idea is, I mean, you can do that. I don't know how, there's no data, I don't think, on how effective that is. But I even tell women, like, afterwards, just lay down, like, just rest. Give yourself a good, like, 5, 10, 20 minutes if you want, and just lay down, right? Even just being horizontal will help to retain semen and sperm and allow it to give it that chance to swim.
Okay, awesome. And I think most of us know that nutrition has a profound impact on overall health. So can you explain how diet affects your fertility?
Yeah. So diet actually plays a much bigger role than maybe some of us have realized. And the idea is that, I mean, we need definitely, there are key nutrients that we need and macronutrients that are critical for producing our hormones and for their function. And we also need antioxidants to help to protect the DNA of our sperm and eggs as well from oxidative stress. So when we start looking at the diet, we also want to set you up for a healthy pregnancy, right? These are all things that you're going to have to do when you're pregnant anyway. So starting early, building that foundation can really help. One of the first things I look at when it comes to macronutrients are, is a woman getting enough protein, right? When we consume proteins, they get broken down into amino acids, and these are the building blocks and the materials necessary to make everything, including our eggs and sperm and many other tissues. So protein requirements are incredibly important, and this is even more so in patients looking to lose weight. If we're looking to obtain a better, healthier body composition, we need protein to build muscle. So the importance of protein cannot be understated there. And then we have our specific nutrients, right, that we get from foods. So, for example, we know that folic acid is really important for both male and female fertility. And we can find folic acid in a lot of our legumes, things like chickpeas, lentils, kidney beans. For an example of male health, zinc is incredibly important for boosting sperm count. It's basically a fuel for sperm and can help to improve the quality and function of sperm. So we find those in different kinds of animal meats and pumpkin seeds and things like that. So all these nutrients from our food definitely contribute to helping everything function properly and building everything properly. And then on top of that, there are foods that can be detrimental for our health. So, for example, having really high sugar intake and having blood sugar irregulation, that can have a really big impact on fertility. Eating lots of processed foods as well, like anything that skews us away from being able to intake all these healthy, productive nutrients and vitamins is going to affect fertility. We're even showing there was a study done in 2018 on the Mediterranean diet on fertility. And what they're finding is that for women who had a greater adherence to a Mediterranean diet, they actually had a higher likelihood of achieving a clinical pregnancy and a live birth And this was in women who were non-obese, who were under the age of 35. But it's the idea of having a good balance in, healthy fats compared to the inflammatory fats, and a good diet rich in, fresh fruits and vegetables, nuts and seeds, and all these whole foods, fish and lean meats. So that whole composition really kind of puts everything into perspective as far as having a healthy, balanced diet that will support a pregnancy, that will support implantation.
Okay, and you mentioned that zinc specifically helps men with their sperm count. Are there a lot of differences in the nutrients that a man would need to improve his fertility over what females need to improve their fertility and support pregnancy?
Yeah, so there are some similarities and there's some differences. For men, zinc is a little bit more important. Women need it too. It's not to say that it's not important for us, but it is very important for sperm. One big difference I find between the two sexes is iron. So usually when we're treating men, we really want to use iron-free multivitamins or formulas because the iron can interfere in the absorption of other nutrients there. Whereas for women, we usually will dose iron and specific forms of iron because most of us are low iron to begin with, just because we menstruate. I mean, every month that we lose blood, we lose iron. And it's very, I'd say in my practice, it's very rare to find a woman with really high or normal high levels of iron. So that's one
Okay,
major difference.
interesting. And we know for women, their hormones play several key roles in the process of conception from fertility right through to birth. So even though men don't have those same hormonal cycles, are there times that they are more fertile?
Not necessarily. So men are always generating sperm, right? Whereas we, have all of our follicles that we're born with. For men, though, they still have to. You still have to generate sperm, though, from the most primordial cells, right? So it takes time for a sperm to go from that little tiny cell to a fully functioning sperm with a head, body, and tail, and have it be able to function properly. So the timeline's a little bit different. For women, it takes us 100 days for our little preantral follicles to be turned to mature into an egg. Men, it ranges. The numbers I've read are, I mean, our average number is about 116 days. I've read one paper that quoted 60, which I thought was a little bit low. But again, you're looking at a good like 3 or 4 months for the development and the maturation of sperm. So as far as, fertile windows, we do know that women have a fertile window around ovulation. For men, there's not that same window because they're not having cyclical releases of sperm. Instead, though, what we often recommend is, not if you're looking to conceive that month and it is, a woman's ovulation window, is to not over ejaculate, basically. So not having an ejaculation, say, like 4 times a day or 6 times a day. We don't want you to hold on to it and not ejaculate for, a couple days. So there's got to be a little bit of a balance there. So a lot of the recommendations are, once a day or even every other day for men. I go somewhere in between, depending again on the situation and how what the sperm analysis is showing, like what's the concentration, how healthy are the sperm, are they swimming properly. So in general, we don't want to overexert the production, but we also don't want it to wait too long. Because what happens is if a man waits too long, say he's withholding for yet like 3 or 4 days without ejaculating, it really changes the quality of the actual seminal fluid as well. So any type of like old white blood cells, sometimes just different types of compounds can kind of sit around for too long, and it can make semen more viscous. And that viscosity is just a reflection of having that debris in the semen. And we don't want anything impeding the sperm being able to swim. We want them to have basically like clear seas, so to speak. So that's why it's important to kind of have that balance of we want a good kind of thinner seminal fluid, and not to hold on to an ejaculate too long.
So I'm currently reading an interesting book titled Roar by Stacy Sims and Celine Yeager. And in the book, they discuss the female triad and how women can better leverage their menstrual cycles in training, which got me thinking about the effects of exercise on fertility. Are there any activities that could be detrimental for women's fertility, such as overtraining?
Absolutely. Yes. I think this is a really big one too, because I mean, so much focus is put on getting women to lose weight and to be in a really healthy body fat percentage for fertility. And I think we really need to focus on the actual body fat percentage instead of BMI, right? So overtraining, when I see women who overtrain, they usually have really, really low body fat percentage. Not all of them, but you can. So there's two problems here. So one is that if you dip below like 20 to 19% body fat, now we're starting to suppress hormonal function and reproductive function. So you might we see this more often, again, women who are underweight, even if they're not training, but if they have low body fat regardless, a lot of them tend to lose their periods and they just stop menstruating. And the reason is because of the suppressed menstrual function. When there's not enough body fat, your body basically thinks you're almost in a starvation mode, and it doesn't think you can handle carrying a pregnancy to term when you don't have enough fat reserves and energy reserves on your body. So that's kind of one example of where we can see that happening. But also when it comes to overtraining, you're also really increasing cortisol levels and stress on the body. So again, that doesn't mean that you have to stop doing vigorous exercise necessarily. But and again, this is also very individual specific, and it depends on that person's individual genetic profile. But typically, when I have runners who come in, especially those who are used to running races and marathons, we tell them, I mean, not to go over 60 kilometers a week in running. In a high stress person, if you have, say, someone who works downtown or in a high profile job, I would cut this back even further, because now you have someone who's been stressed all day long at work and now they want to go stress their body with a 2-hour run, right? So I typically cut back most women to about 20 to 40 minutes of very vigorous work and no more than 60 kilometers a week of running.
Okay. Cool. So then a few episodes ago, I was talking to Joy McCarthy, and we were discussing how some chemicals mimic estrogen, such as parabens, phthalates, etc. So can those also interfere with the fertility and fetal development? And do you recommend clients move away from using plastics or conventional personal care items that are laden with these toxins?
Yes, 100%. It's even more so in patients with endometriosis or any type of autoimmune condition or inflammatory conditions like fibroids or chronic cysts. I find it's just, and most patients I'll tell them to avoid these regardless, but it's more important in those specific instances. And the research on BPA is growing and it's extremely strong. I mean, we're showing that, I mean, in IVF fertility clinics, we're showing that exposure to pesticides and BPA can lead to poor outcomes. It can lead to diminished ovarian reserve and decreased egg quality. Um, Parabens we know have been linked to low clinical pregnancy and live birth rates. And so these are things that we need to be very, very cautious about. And I think a lot of us shrug it off because the half-life of these compounds is actually pretty short. BPA itself only has a half-life of 6 to 24 hours. I think phthalates as well, I think only have a half-life of about, on average, 12 hours.
Oh, wow.
Um, yeah, there's a great book out there. I can't remember the authors, but it's called Death by Rubber Duck, and they kind of go into that. They're testing basically the compounds in their own urine and their exposure, and so the half-life is actually pretty short. But that doesn't mean that we need to take this lightly. We can't assume that our body is being very efficient at getting rid of these chemicals, and even while they're in our system during those 12 to 24 hours, it can still have an effect. Now, that being said, we can't be perfect all the time. And that's what I love about this one book, is they mentioned, I mean, you cannot avoid all plastics in our world. It's just impossible. And that's okay. The idea is that we just want to reduce exposure in as many ways that we can, where we do have the choice. So that does mean, looking at your body products, your everything in your medicine cabinet, and what you're putting on your body, shampoos, lotions. Yeah, we want to avoid chemicals like parabens, phthalates, artificial and synthetic fragrances. All these chemicals do build up, and you have to think about everything else that we're exposed to that the liver has to process and get rid of for us. I mean, there's air pollution. And different chemicals on our food. There's our drinking water. I mean, we're exposed to pollutants everywhere. So if we can take control over some of those and maybe choose not to wear perfume, or to use unscented paraben-free, lotions and shampoos and soaps, I mean, you're doing already yourself a pretty big service. Even choosing a couple organic foods whenever you can or when it's possible within your budget for the week for groceries, I mean, that's going to help as well.
So beyond like diet, personal care, all those things that you already mentioned, are there other lifestyle and environmental factors that can have an effect on fertility, which people can control for themselves?
Yeah, so there's a couple that we tend to investigate, especially in cases of infertility. The first being just overall sleep patterns. Poor sleep quality and not getting enough sleep can negatively affect your fertility. And we find this a lot in shift workers. So it's really tough because if you are a shift worker, it's not like you can just up and change your job, but it's something that we need to be very cognizant of. And for those who aren't shift workers, who maybe are only getting, 6 hours of 6 hours a night of sleep or less, this is something that we have to change. We have to change habits. So going to bed earlier, waking up, or changing your wake up and bedtime routines to make sure you're getting enough hours in. I find that a lot of people just want to stay up later to spend time with their partners, which is, I mean, it's heartwarming and wonderful, but we also have to get enough sleep to have proper gene regulation, to solidify memories, and have proper repair in our bodies as we rest. The other thing that's really kind of up and coming in our research is the microbiome, and not just the microbiome of your gut, but the microbiome of the actual vaginal and uterine environment. And this is really neat and something that I'm really interested in right now is, and testing is actually new for this as well. So it's called the EMA test, and it's a test of looking at the microbiome inside the uterus. And because we're finding that certain what we call lipopolysaccharides from bacteria, specifically gram-negative bacteria, can actually suppress or change our hormone function. So some studies are reporting that it can alter the receptor function of follicle stimulating hormone and luteinizing hormone in the uterus. It can lead to, when we have a poor lactobacilli presence, it can also lead to the failure of implantation. So we're seeing this more and more in IVF clinics when you're transferring a very healthy, normal euploid embryo and it's not implanting. So that's why now in clinics we're really screening for antibiotic use, history of vaginal candida, so yeast infections and bacterial vaginosis, and looking at the different factors that can affect both cervical mucus and the pH of the whole environment.
Oh, well, that's super interesting. Unfortunately, we've reached the end of our time for today. However, we're going to bring you back next week for another episode to continue this conversation. So thank you so much for joining me today, Sarah, and I look forward to speaking to you again next week.
Wonderful. Thank you so much.
Thank you for listening to Supplementing Health. For more information about our guests, past shows, and future topics, please visit aor.ca/podcast or aor.us/podcast. Do you have a topic you want us to cover? We invite you to engage with us on social media to request a future topic or email us at marketing@aor.ca. We hope you tune in again next week to learn more about supplementing your health.